Hello and welcome to the very first episode of Health Xpose TV. My name is Aldwyn Altuney and we have a great treat in line for you today. We are going to be talking about how to be happier, healthier and reduce pain in 2018. And if you're watching this later in 2019, this I'm sure will apply for any year in the future. It's all about being happy, healthy and reducing pain, and we're speaking to a fantastic expert today. He's a Brisbane musculoskeletal therapist. His name is Samuel Minkin. Now, Samuel founded Recuperate Health and Wellbeing 2 years ago in Wakerley in Brisbane, and a practice also inside City Cave Float and Wellness Centre in Rosalie 4 months ago. His passion began as an exercise specialist in 2012, moving into sports medicine where he worked with many elite sporting athletes, including Australian table tennis star Miau Miau and Queensland boxer Benny Kite. About 3 years of clinical experience treating countless conditions and about 5 years of study has given him the ability to fully address his patients' issues. With his practice specialising in musculoskeletal therapy, he takes a holistic approach to assessing and treating every issue thoroughly and effectively. Hello and welcome, Samuel.
Hello, how are we doing today?
Excellent. Thank you so much for joining us. I can't wait to talk to you. I know you're so experienced in this field. And for those that don't know, we actually met in the crowd at the World Table Tennis Championships on the Gold Coast. And we're in the audience, and you were mentioning that you were actually treating some of the table tennis players. So can you explain what you were actually doing at that table tennis tournament and how you helped the players there?
Okay, so basically, originally I was there doing a bit of the first aid and the medical side, but I was also there to help them with any issues they may have had leading up to the event and during the event, which a few of them had a few issues, and they, even though they're professional athletes, they're not sure how to address it either.
Right. Interesting. And how did you actually get into this field in the first place?
Well, in regards to sports medicine, I've been doing that for about 5 years. So I started off doing junior sort of sports. I would go out into the field, assessing injuries, assessing concussion. And then I started to get more high profile games. And then during this, I was also studying with my Bachelor of Health Science. And basically everything I learnt in that, I'd apply as soon as I was working again. So I'd learn something through the week, I'd get to the weekend and I'd go, I know this, I just learned about this. But as I was learning it, I was using it, and it just gave me a better ability to cement in what I was learning. And by the time I finished the degree, I'd already had hundreds and hundreds and hundreds of hours treating, assessing people, going to their training sessions, reviewing their injuries from the week prior, and getting them ready to return to sport.
And which university was that you went to?
So I went to Endeavour College of Natural Medicine, and it's a natural health university.
Okay. Is that in Brisbane?
It's in Brisbane. So I went to the Fortitude Valley campus.
Okay, fantastic. And you do things a little bit differently, don't you, to the way they traditionally teach you how to do things. So how did you evolve to create your own method of treatment, and how is it different from traditional treatments?
Well, I found that most traditional methods, it's very pathology driven. So, you might go to a specialist, you might get a scan, and they go, this is what we found in the scan and this is the issue. But that's not necessarily true. You can have an injury, or you can have something show up on the scan, but is that the root cause? And is that why you're experiencing pain and dysfunction? It may be, but it may not be. And it's just important not to get bogged down in the symptoms, symptom by symptom. You've got to kind of have an understanding of the body, take a few steps back and go, well, how does this relate and why are all these symptoms relevant, instead of just looking at one thing.
So instead of being a Band-Aid treatment, you're actually getting to the cause of the problem.
Absolutely. And it's once you get an understanding of the body, once you start trialing different techniques on patients and you can see the results, it all makes sense and it all comes together.
And what are some common mistakes that people make when it comes to getting treatments, or like say someone's got some pain? What are some common mistakes that they do?
Well, primarily they look where the pain is. So say you might go somewhere and they say you've got thumb pain, We can spend months and months treating the thumb, but it could be something else. It could be a C6 nerve root referral. And it's just important to rule in and rule out certain things. So the way I like to treat is a patient will come to me with a presenting issue, and they'll tell me what's going on, how it started, and in my head I've thought of a diagnosis. And then what I like to do is I like to do a whole bunch of tests. I try and disprove myself. So I go, okay, this is the condition, or this is what this person may have. I'll do a whole wide range of orthopedic assessment. I'll try and prove myself wrong. If I can't prove myself wrong, then I've probably got the right diagnosis. And it happens quite often. I'll think, well, this is what this person is likely to have. I'll do testing, and I'll go, oh, wait on, well, no, that come up negative. And then I'll do some more testing, and it gives me a whole nother idea. So I think always try and prove yourself wrong, because if you can't prove yourself wrong, you're probably going to have the right path.
I think it's important to question everything also when it comes to health, isn't it? Because, we know the world is pretty much run by pharmaceutical companies, and there's another show I do called Health Xpose TV, and, we do cover some controversial topics. And it's interesting that health is called, or some forms of health are called alternative health, whereas alternative health is actually based on things that go back thousands of years, like shamanism and original treatments that go back thousands of years with the original treatments. And yet pharmaceutical and drug companies have come out in the last few hundred years, and they're calling that the mainstream way of medicine and the right way that people should be treating themselves, instead of going back to maybe some more natural treatments, which people have had phenomenal results with. So, for example, the documentary, The Truth About Cancer, that you can find that online, that shows that there were actually many different cures for cancer that have been found over the years, and people have actually been shut down for their beliefs, and basically shut down by pharmaceutical companies and threatened in all sorts of ways to shut them up, because it would affect the multi-billion-dollar industry that is pharmaceutical driven, with things like chemotherapy and drugs that go with that. So it's a big topic. So it's interesting, the whole term alternative health was actually really the original way that people did health, and I think we're coming back to that. So what sort of trends are you seeing now where people are people questioning doctors more than before? Are they questioning mainstream opinion about health, and are people starting to do things differently? What have you noticed?
Yes, absolutely. More and more I'm getting patients coming in and going, hey, my doctor has told me this, or this person has told me this. Can you just give me what you think it may be? So a lot of time they're coming for just a differential diagnosis, or a second opinion, just to see what I may think. And it's quite shocking. A lot of the time it's not what they originally were told. And I've been able to fully remediate them without them going forward with the surgery. Probably this year I've had about 14 surgeries cancelled, and they just didn't need it. And even now I still get messages from them saying, thank you, blah, blah. I thought that this was this, and I was so afraid. And I think a lot of it can be fear as well. When people are scared, so they get offered these alternatives like, we need to operate, it needs to happen now. And it doesn't necessarily need to happen, especially when it hasn't, the other avenues haven't been explored. And a lot of the time you explore these other avenues and they are successful. It just takes time, but most importantly, it takes the right diagnosis. So you can treat someone for months and months. If you've got the wrong diagnosis, if you didn't do enough testing initially, you're going this way and you should have went that way. And when you hit the nail on the head, you often find that people do get better, they feel better, and they're able to move better.
Yes, it's interesting. A lot of people think doctors are God, and they think whatever a doctor says must be the way to go. Whereas I saw some stats recently that showed there's hundreds of thousands of people that die. In fact, over 100,000 people die every year from doctor error. So don't believe necessarily what one doctor says. I would suggest going to multiple doctors, going to alternative health people. I think there's a place for traditional medicine. Like, I think, there is definitely a place for it. In emergency situations, I think, doctors or emergency wards can be potentially a good place. However, I just think people should question things before just blindly taking whatever tablets are prescribed. You know, like antibiotics, for example. People don't know that antibiotics kill the good bacteria and the bad bacteria, and they kill the good bacteria forever. You know, whereas nature's antibiotic is garlic.
Yeah,
for example. Simple. You know, and the sunscreen causes cancer. I didn't know sunscreen caused cancer until recently, and apparently coconut oil has a natural, pure coconut oil has a natural 15 plus sunscreen in it. Also, like a natural, it protects you from the sun, whereas most people think it helps you tan, which it does help you tan as well, but also protects you from the bad rays out there. So I've heard, you know, do your own research on this, but, you know, I'm not going to be putting any traditional SPF sunscreen on my skin, and I'll be using coconut oil from now on, and it feels fantastic on your skin. But of course, coconut oil is $5 in the supermarket, whereas, you know, the sunblocks, etc., are so much more, and you know, certain people aren't profiting by buying coconut oil. So it's just things like this, you know, it's amazing what's going on out there, and what we believe to be true that may not necessarily be true. So when it comes to doctors giving advice, so you've seen firsthand how doctor error has, or potential error, where they could have actually gone to surgery, and you've actually helped stop them from doing that. I mean, that's fantastic, because I've heard so many stories of people that go to surgery and then afterwards their condition is worse than before surgery.
Absolutely. In fact, I've actually got a patient at the moment who, yet again, he's another failed back surgery patient, and leading up to his surgery, he was in quite a bit of pain. He didn't get a second opinion. He wasn't sure. He was just told that this needs to happen, and he went and had the surgery. And the amount of pain he is in now is tremendous, and it is quite upsetting. But we're slowly chipping away. He's developed a whole psychological side of pain. We're slowly getting there. I'm trying different techniques. I'm trying techniques such as vagus nerve stimulation, which is a modern medicine technique. And I'm just using that to treat his brain, calm down his emotional side, because pain is processed in the same area that emotion is. So because he was told, you're going to be in pain for the rest of your life. I can't help you with the pain. You've got a permanent disability. And these are the things coming from his surgeon. And like, the way you say things to people, it matters. And that after getting told that, he needed counselling. He still requires counselling. That emotional aspect has been brought into it, and he's very sad, he's depressed. His pain has been augmented. So I'm kind of going around the back of pain, going, okay, well, I know that his emotions trigger his pain, so I'm just working calming that down, and his pain will decrease.
Now, there's a great book that came out many years ago called Heal Your Life, right, by Louise Hay. And Heal Your Life looks at the emotional situation behind any physical pain. I don't know if you know that book, do you?
I've heard of it. I haven't yet read it.
Okay. Well, the book is full of affirmations around different things. So if you have back pain, it'll have an affirmation about feeling supported, maybe, because people say, well, if you've got back pain, that means you don't feel supported, for example. And she has a whole lot of affirmations, and some people really swear by that. So so really what she's saying is that emotional issues can trigger physical pain. So how much do you see that happening in your practice?
Quite a lot, actually. In fact, when I have a patient come in and I'm doing the initial consultation, my path of questioning, it's, well, when did the pain start? And that's mostly where a lot of practitioners start with their question. They go, where did the pain start? And then they move on. But then what I also ask is, well, what happened then? Did you have something traumatic happen? A death in the family? Did something happen? And a lot of the time, if it's something that they've had for quite a few years, it's chronic and it's quite severe, there is something. And they go, well, actually, yes, I lost my job. And then this happened. I had a breakup with a husband. And they go, okay, well, and that's relevant because those emotional things cause an inflammatory cascade, and underlying issues which maybe weren't felt at first start to become, they surface a little bit more, and we go, okay, well, that hurts. How do you treat that? Well, you've got to address it holistically. You can't just go, oh, you've got a sore hip, we're going to treat the hip. got to address it from all avenues. Dietary, lifestyle, emotionally and spiritually as well. Very important.
Yeah, fantastic. So what if a client comes in and they don't know what it could be? I mean, maybe they, like, you know, depression's a big thing, for example. You know, 1 in 5 people that we know of in Australia have depression. You know, it's probably more like really 2 or 3 that are undiagnosed. So what if people come in and they have no idea what the problem could be emotionally, and all they know is they've got this persistent pain? So how do you work with those people?
Well, in regards to that, what you can do is you can go for more of a functional medicine approach. So you might refer those patients off for blood tests, and you can actually have a look and see if their body is in a systemic inflammatory sort of state. And by looking at blood, you go, okay, well you're quite high you're pro-inflammatory. And inflammation increases pain. So by controlling inflammation, that's one avenue of decreasing the pain. Obviously, even if, basically the techniques I do, they work on desensitizing areas as well. Say you've got knee pain, you don't know why you've got the knee pain. I've got techniques that I can do, in particular, electro dry needling. So say you have a sore knee, I could put 2 needles into the knee if you're not afraid of needles. Some people are, but some people, they're afraid, but they're willing to try it because they've been in pain for so long. And basically, the needles go into the area of pain. I do some electro through there. Basically, just the message goes through the spinal cord up to the brain, into areas of the brain that basically perceive pain and give appropriate sort of measurements of pain. And it raises threshold. And the messages come down the spinal cord and say, let's decrease the pain. So basically, I can decrease the pain in the periphery by treating the central nervous system.
Interesting. Does that work with acupuncture points in your body?
I know that they do electroacupuncture, but from what I do electro dry needling. So we use the same needle. It's still a filiform needle, but it's completely different methodology. Acupuncture is traditional Chinese medicine sort of framework, whereas I'm more of this is where the pain is, or this is what relates to the pain. So I might say you've got sciatic pain, I might electro needle the nerve pathway. So I go, okay, well, this is where the nerve runs, and I'll run needles either side of the nerve pathway, and I'll electro that, and I'll calm the nerve down. It treats it in the periphery, but also, which is the external, so it's the arm, it's in the external. It also works on the brain. It changes chemistry in the brain. Recently, a study has shown that the method of pain inhibition with dry needling was adenosine. It releases adenosine at 3 places: the brain, the spinal cord, and the periphery. So now we know exactly how we're decreasing pain.
That's really interesting. And you mentioned inflammation is a bit of a dangerous thing. So how can people reduce inflammation in their body?
Well, sugar. It always comes back to sugar. Well, not sugar solely, but you've got to watch what you're eating. A lot of the time, you can go to a supermarket and it says, sugar-free. Sugar-free does not mean sugar-free, okay? You haven't heard this, you need to know it. It doesn't mean that. And sugar, honestly, if it wasn't so widely accepted, it'd be illegal.
Yeah, well, that's right. Sugar-free and things like Equal have got aspartame in them, which aspartame is very, very dangerous. So people need to do some research into that, look up what aspartame is. And yeah, a lot of foods have also got MSG in them.
Yes.
Anything with 3 numbers in it, or anything in a packet, pretty much is going to make your body acidic, which will cause inflammation, right? So we look at alkaline levels and acidic levels. And the best thing for alkalinity is apparently wheatgrass. Wheatgrass and lemon is also fantastic. So some other things that people can do. What are some other things people can do to become more alkaline and have less inflammation in their body?
Well, basically reducing stress. Reducing stress is so important. It can be a trigger to a lot of things, a lot of conditions, even autoimmune diseases. So something, as I mentioned just previously, something traumatic happens, death of a family member, that huge emotional issue can trigger the immune disease to switch on, and you've always had it, but it hasn't been active, and now it's active. So stress is a really important thing, trying to reduce your stress. Meditation, very important. And just breathing. It really is about breathing, trying to control your breath and breathing correctly. A lot of people don't breathe correctly. In fact, something I've noticed in clinical practice is people who are anxious, who have a high level of anxiety, the way that they breathe, it's called apical breathing, and they're chest breathers. They go, and what these patients are presenting with is upper limb tension or numbness in their hands. Oh, I've got a numb pinky, I've got a numb thumb, or I've got carpal tunnel. And is it actually carpal tunnel? Well, a lot of the time it isn't carpal tunnel. With the right testing, you can take it back to, oh, they've actually got a thoracic outlet. So the way it relates is they breathe incorrectly. They're not diaphragmatically breathing. And by breathing like this, their first rib gets elevated, and the space where the nerves that supply the arm, where they go between the first rib and the collarbone, there's less space, and there's symptoms, numbness, or they've got hand pain. And you can take it back to this region here, you can treat here, and the symptoms are gone. I've had people booked in for surgery, carpal tunnel surgery, and I've done a few tests, and it's thoracic outlet. It's not, they don't need the surgery. It's pseudo carpal tunnel.
Wow, and how about mobile phones or smartphones? Like I find sometimes if I'm on my phone a lot, my whole arm will suddenly start going numb and tingly if I'm using Wi-Fi or if I'm holding the phone. So apparently it was proven that mobile phones cause tumours, apparently 7 years ago or so. And in the fine print now, when you buy phones, they say you need to have the phone 20 centimetres away from your body at all times. So a lot of guys have mobiles in their pockets. They end up getting cancers and all sorts of things. So so what about radiation from mobile phones? How's that affecting?
Yes, there are studies showing that radiation coming off phones, and there are correlations with increased prostate cancer and that. But you can look at disease as a holistic thing, or as a holistic thing as well. So you've got this underlying thing, you've got this radiation, and then you've also got a poor lifestyle and a poor diet. You've got things that are pro-inflammatory, and the things you're eating, the things you're doing are supporting that disease. And that disease is able to spread and grow much faster than it would if you were controlling your diet and your lifestyle. And it's just the day and age that we live in. We're exposed to so many things, and it's so hard to get away from it. Like, how do you get away from all this stuff? Whereas if you can control your diet, if you can reduce inflammation, you can limit that. And there's only so much we can do. Unless we go out into an island and start our own sort of civilization, it's going to be hard. And what we can do to remain happy and remain healthy is take our diet into our own hands, take our lifestyle into our own hands. So when we are exposed to these things that in this day and age are inevitable, we can reduce its impact on us.
And then there's things like fluoride in the water supply, which fluoride calcifies your pituitary gland apparently, and can dumb people down. And the other thing that's affecting a lot of people, from what I've heard, is vaccinations. And there's a fantastic documentary out there called Get Vaxxed, where a lot of people have watched that, have been pro-vaccination watching that documentary, and they've come out and been very anti-vaccination. And this is a documentary that the powers that be are trying to shut down. They don't want people to get this information, but a lot of kids now apparently that they've had vaccinations, which of course the Australian government is making compulsory, and in America and other places, for kids to get vaccinated. A lot of them are ending up with ADD, ADHD, autism, all sorts of situations like that. Do you know much about the correlation of vaccinations and body health?
Well, I've actually got a personal story. An ex-partner of mine had a daughter, and basically, yeah, she was vaccine damaged. She was injured as a result of that. She initially had she had something called cerebral palsy, and what happened was she was told that she needed this vaccination, and she got that, and she nearly died. She was hospitalized for 6 to 8 months.
Wow.
And then it came around the second time, we need this vaccination, and just her body couldn't handle it. She's already immune suppressed. her body wasn't ready for that. And then she had the second one, and basically her level of cerebral palsy just was exacerbated. Once she had the ability to support her own trunk, she had the ability, she was making the sounds of A, B, C, D, developmental milestones, and straight after that could no longer support her trunk, could no longer make any sort of sounds, and basically just put a hold on her development. Yeah, it's going to affect her for the rest of her life, unfortunately.
And that's just one story. There's so many more out there. I know there's documentaries continually being made about this because more and more things are coming out about it. And it's just another lie that we've been fed by the powers that be, I believe. Of course, do your own research if you're watching this. It's just another lie I believe we've been fed, and people think that they have to do it. And there's apparently homeopathic vaccinations that are meant to be okay. So there's different ways of doing things, apparently, that aren't as harmful as the toxic chemicals apparently that people are getting. So of course, if someone's been vaccinated, that's you're seeing the end result of potentially something that could be caused from that. I had a tetanus shot before I went to China about 20 years ago in my backside, and I ended up with a massive lump there, and I had sciatica. I had shooting pain down my leg for 2 years after this shot, this tetanus shot in my butt, and so now I just stay well away from doctors. I do things as naturally as possible, and I have so much energy now. And I think I heard the other day, I was at an event with Stuart Siddell in Sydney, and he asked people, what is health? And people had a whole lot of different answers for that. In fact, what's your answer for that? What do you think health is?
Health? Okay. Well, health to me, it has to be a level of, it has to be the spiritual health, there's emotional health, and emotional and spiritual health are two different things. A lot of people throw them in together, but they're two different things. Spiritually, you've got to be healthy. Emotionally, you've got to be healthy. There's physical health, and basically you've got to be comfortable, and you've got to feel good. So a lot of the time people, they don't feel comfortable, don't feel good, and they're not healthy. It's basically being able to live your life without meeting milestones and barriers that stop you to do what you want to do.
Yes.
So don't inhibit your ability to reach goals and do things. It's a barrier. If you've got poor health, it's a barrier to reaching goals and succeeding, things that are important to you. So I suppose my definition of health would be being in a state that you can achieve and do anything that you would like to do without meeting any barriers.
Nice. Yeah, I like that definition. Well, Stuart Siddell said health is energy. He just kept it really simple with one word. Health is energy. And I never really looked at health that way. And I think, health is probably a whole lot of reasons, and I think all the reasons are valid. Bringing it back to the simplicity of health is energy, and if you look at, everyone actually vibrates on energetic fields, and we're basically, everything's vibrating energy around us, and we are vibrating energy. And so Stuart said health is energy, and then he showed a photo of a raw broccoli, and it had this aura around it, kind of like an aura that human beings have around it. And then he showed a steamed broccoli, a photo of a steamed, there's special kind of photography that pictures the aura around vegetables and different things. And the steamed one had only about 20% of the original vibrancy and energy of a raw piece of broccoli. It only had about 20% left. So basically what he's saying is, by cooking your food, most people, by cooking food, a lot of it is actually waste product, and the body can't use it. And so a lot of your energy goes into trying to digest the food that you put into your body. And of course, people eating a lot of takeaway food, fast food, which is actually slow food really, because the fastest food is food straight off the tree or straight out of the garden. That's the fastest food. That's another lie. Yeah. Just being aware of that, and he said a lot of people also with meat, and I know there's differing opinions on meat. He said it's like having putrid, rotting flesh in your body, and when I heard that, that really turned me off eating meat. And so I've stopped eating meat now for the last week or so, and I feel amazing. I have a lot more energy. I'm eating raw food as much as possible. I'm eating less food. So the thing is, you don't need as much food if you're eating well as well. So what's your personal experience with your food journey, and what have you found works well for you to increase your energy?
Well, actually, I found the same thing as you, decreasing my meat intake greatly. It improved the way I woke up, improved the way I went to sleep, improved the way I even performed. I play basketball, the way I performed on the court, so much better. I remember playing a game and thinking, geez, I feel good today. I think, so I haven't eaten meat for a while. And yeah, it was just, I had a positive influence around me. Said, hey, cut down your meat, or try not to eat any, or just try something, trial it, see how you go. And it was good. It was great. I personally, I'm going to go back. I'm going to go back to, I wouldn't mind being a vegetarian again. I was that for 6 months. And that was the best I've felt my entire life. I had people coming up to me saying, oh, Sam, you know, you've been working out, you're looking good. And I'm thinking, no, I haven't been working out. What are you talking about? Oh, you just look good in your skin and you're glowing. And that's what it was just my diet. My diet changed the way I felt mentally was the most important thing. I was quite stressed in my last year of university. I had lots of stuff going on. And I tell you what, diet plays a huge role in mental health. Now, just recently we're starting to hear more and more about the gut-brain axis and the interaction. You know, the gut is the second brain. It literally is the second brain. If you do some research, have a look at, you know, the why it is that, and the importance of the gut bacteria. You'll understand why that affects mental health.
It's very interesting. Well, I was vegetarian when I was 18 for 3 years, and I was actually giving blood also at the same time. And I actually got quite weak at around the 3rd year mark. And I had this story in my head that I need meat for energy, right? And so I started eating meat again after that. And really, that doesn't seem to be the case at all. And our bodies can't digest meat properly, and they can't also digest dairy products properly. And we're not meant to be suckling from cows, and that's a whole other story. And Stuart said, I wonder who the person was that went up to a cow and said, I wouldn't mind a piece of that, right? And he said also, if you give a child a rabbit in one hand and a fresh mango in the other hand, the child's going to naturally go and eat the mango, not to eat the rabbit, right? So he said, your body knows what is good for it and what gives it energy. And I mean, it's amazing. Since I've changed my diet in the last week, I've just the weight's just been shedding off. I've toned up. I've got more energy. I've got more clarity. I'm not sleeping as much. I'm not eating as much, and I'm getting so much more done with my day. And it's amazing how it can really lift your mood. It's quite phenomenal. And moving towards an alkaline diet. And actually, Stuart Zadell himself, he is a pure vegan, and he actually thinks, he was leaning on, he actually thinks that human beings are meant to be fruitarians. That's a whole other story. And he said fructose isn't actually as bad as people make it out to be either. Fructose, which is the sugar from fruit. And he said he gets blood tests done every year with naturopaths, and every year the blood is perfect. They always say, it's amazing. He has perfect blood, and he's pure vegan. So isn't that interesting? And if you look at gorillas, you look at some of the strongest animals in the world, gorillas, cows, or bulls, they're vegetarians.
It's absolutely right. And it's a great point. It's a great point. And even if you look at our biology, our stomach acid isn't the right pH to digest meat, okay? Our teeth aren't the right teeth to actually be chewing meat. Originally, when you go back, hundreds and thousands of years, you can, but there's been, we've developed, evolution's happened, and you can see what people ate back then and the health issues they had, and what people eat now and the health issues we have. And it's all commercialized. You should eat this and eat that. Really, you should eat what your body needs, and not what looks good on a billboard. Yes, exactly. Basically, what Stuart was also saying is that supermarkets are one of the most dangerous places you can go to, as well as hospitals. He's saying one of the most dangerous, one of the most unhealthy places you can go to, and except for the fresh food section, maybe in the supermarket. But of course, buying organic, that's really ideally the way to go, or growing your own fruit and vegetables. There's nothing quite like having homegrown fruit and vegetables that you can just have fresh. That's really the best way to go, I think, eating wise. So what about exercise? So you have certain exercises you give your patients. So how important is exercise as well with being healthier in 2018? Exercise, as we already know, exercise makes us feel better. It makes us feel happier. We're releasing endorphins. And it's important to feel good while we're exercising, okay? And basically, we need to exercise because we need to stay healthy. We need to be burning the calories that we're putting in, and we're eating all these foods. We need to be burning that off. We need to be using our muscles, circulating blood. If you're not moving, then the blood's moving, but it's not moving as much as it could, and we're not pushing as much oxygen around. And oxygen is needed to keep cells alive. So we need to be moving. We need to be getting fresh oxygen to all the cells in our body to keep them alive. And in regards to pain, if we're not moving, what we find is, say, you're an office worker, you're like this all day typing away, and we're not moving, the blood in our muscles becomes stagnant, and we start to build up levels of lactic acid. Then we start to go, I've got a tight shoulder, my muscles are sore. And it's because we're not moving. We need to get fresh blood. We don't want ischemic muscles, which is what people present with. They present to me with ischemic muscles. The muscles have low levels of oxygen because they're so bound up and they haven't been used. And it's important to move. You've got to move to stay well. Joints in particular, joints like to move. They like to slide and glide. If they're not sliding and gliding, they get stiff. When the joints get stiff, so do the surrounding muscles. So movement's very important. It's important to use what you have available. So, if you're able to put your hands all the way above your head, do that daily. If you're able to bend down and touch your toes, do that daily. Do what you can and work at improving your mobility. And what you'll notice is, when you're more flexible, when you're stronger, your ability to do day-to-day living tasks is a lot better. Plus, you're feeling happier. You're doing things that you can do. As we age, obviously, the whole sort of idea that as you get older, then you just can't do this because you're old. And it's not, to a degree that's true, but if you stay moving and you stay active and you stay flexible, your ability as an older person or a more mature person to do things and look after yourself is going to be much higher. So we need to start this now. It's preventative medicine. You don't want to be going, oh, now I can't do this and I'm 86 years old. Start this. It's good. If you want to start it then, yeah, good, start it. But if we can start it, if it's just day-to-day living and it's habitual movement, then we're going to prevent so much more stuff from happening. We're going to live happier lives.
So what are some simple exercises you can do if you're just sitting at your desk? I'm very aware now talking to you, my posture's probably not the best. So I immediately, sit upright. So what are some things we can do if we're kind of stuck to an office job, or, we need to be at the desk? What's some simple exercises we can do while you're sitting down?
Well, while you're sitting down, what you can use is use the back of your chair as a block. And what you do with that is you lean over your chair, and you just go back and forth over your chair. What this does is it actually mobilizes our spine. So by sitting all day in this hunched position, we need to open this up, we need to reverse this. So say I had a block behind me, which was the chair, I'd be leaning back and I'd be extending as far as I can and coming back, and extending as far as I can and coming back. And even just doing that through a few levels. So do that for about 30 seconds, move yourself down the chair a little bit, try another level, and just by mobilizing those joints, it's going to keep the joints happy. It's going to keep the nerves happy because nerves like joint position, but also it's going to keep the muscles happy. Hopping up, if you can, every 40 minutes and just, moving your head around, stretching, getting up, and even just get up and getting a glass of water. Get up, walk to the bubbler, get yourself some water. Just that movement, it takes your mind away from the work, which is going to give you a bit of a break, give you a bit more clarity when you come back, but also, hydration. Little things, just tie it in and don't make it like an exercise, like I need to do this. Just make it like, I'm just going to get a glass of water. And incidentally, what you're doing is you're hydrating, you're walking, you might bump into a colleague on the way, you got a bit of general chitter-chatter. And when you come back to work, you're more refreshed. So just getting up and moving every 40 or so minutes is important.
I like that, very good. And I often roll my shoulders too. I don't know what you think about that or if I'm doing that correctly, but I often do roll my shoulders. I find that really good. And I often just twirl my feet as well from the ankles. I like doing that too.
And that's very important, that the movement of the feet, especially when you're sitting all day. What you can get is what I've found a lot of office workers get, in particular females, that come in and they've got like swelling of, their ankles puff up by the end of the day. And what that is, that's lymphatic fluid. It's because they're not moving. And movement's important because as we move, and as you said, you roll your ankles, even calf raises, pumping your feet, pumping your calves. It helps that venous return and pushes the fluid from the extremity back into the circulatory system. It decreases the swelling we get. If you've got a high level of fluid retention in the periphery, it can actually be quite painful.
So what's the ideal sort of chair? Like some people use those balls to sit on, some people do stand up at their desk. I mean, what is ideal if you're working a lot you've probably seen those balls that people roll on that they use as a chair.
I personally like the stand-up method. I like the stand-up desk. I think it's good. Having your screen at a certain height so your eyes are straight, you're not looking down. And also, a lot of things I get with people's ergonomics in regards to their office is they've got something maybe to the right of them or to the left of them. All day they're turning their head like this. And these people present to me with headaches. And normally what it is, it's a rotation in the neck from doing that all day. The way that the bone in the neck, it faces one direction, and then when they're looking straight, we're getting compressed nerves, we're getting migraines, dizzy, but we can even get brain fog from this as well. So basically moving stuff in front of you. So if you're facing your work, you're doing it here. If you need to look over there, turn your whole body. Whereas if you're sitting, you can't really do that too much. You're not going to turn your chair. You're just going to turn your head. But if you're standing, you can feet first and face the work you're doing. It's important.
Yeah, that's really interesting. So we've covered pretty well the happier, healthier thing. Now, there are about 16 different cultures out there apparently that are living to 120 to 140 nowadays. So on the topic of health and what we believe to be true, the average age for men is around 70 something, and I think for women around 80 something is average lifespan of Western society and generally in the world. However, there's certain cultures that if you look up longest living people on earth and what they do, they live off the land, they do things naturally, they are exercising, they are eating well off the land, they're keeping active, they're with families, they've got that community. So it's interesting to look at that. And a lot of these cultures, they've never heard of anything like cancer before. So it's just interesting how we, what we believe to be true that may not. And I think it's good to model these people. And, why not live to 120 to 140 or even more? Apparently years ago, they even lived to up to 250. So there's ways that you can extend your life. And anti-aging is pretty big nowadays. So, of course, if you're healthier, you will be happier and you will live longer, I would say. What are some other things people can do to live happier, healthier lives, Samuel?
Take time for yourself. It's really important to take time. Take some time away from work if you can. Use your weekends. When you've got the time available, don't just sit inside watching the TV. If you've got a family, get your kids, take them outside, do things. Get the sun. We need sun exposure. It's important. We need to get the vitamin D from the sun. It's very important. In emotion, how we feel. We need to teach our kids that going outside when we can and playing, being barefoot, even grounding, being barefoot on the ground, it's important. We don't want to teach these bad habits of, what do you do on the weekends? I put on Netflix and I watch these videos and that's what I do, because that doesn't encourage good lifestyle. We're not moving and really we're not happy. We're finding happiness in a completely separate realm. It's not finding happiness in a screen. It's not finding happiness in our surroundings. I was talking to my housemate yesterday, and we were having a discussion about these people who say, Australia, it's a terrible place and all this. Well, you need to explore. You need to see what's out there. Yesterday I went to a place called the Natural Bridge, and it's just over the border of New South Wales, and we went to a waterfall, and it's beautiful out there. And as soon as you're there, I was honestly, I was in a bit of a not so good mood. And as soon as I was out there and I hear the birds and just the smell of it in the air, instantly I felt better. It's, you know, and I thought, oh, you know, this is going to make me feel better. And even me knowing that it will make me feel better, I think, oh, it's not going to make me feel better. I went out there, I felt great. I was playing with the dogs, I was looking at the waterfall, and it just puts things into perspective, especially when you can see how big things are, so how big the waterfall is and how big these trees are. You start to think, oh, well, the problem that I initially thought I had is so small. You know, it's such a small thing in such a large, you know, habitat ecosystem. So it's good to get out. You know, we need fresh air. Get out and about.
Absolutely. I couldn't agree with that more. I live on the Gold Coast and I love the beach. I grew up in the Northern Beaches area of Sydney, near Manly. I've always been near the beach, except for when I went to uni, and I did that in Canberra, and I just about went crazy for 3 years. It was not only freezing, but it was like 4 hours from the beach. That's way too far for me. So I love the beach personally, and that's a great way for me to ground. So getting your bare feet into the soil or into the sand. And I find actually having a swim in the ocean, I find that so rejuvenating, refreshing, revitalizing. I absolutely love swimming in the ocean. In fact, I went for a sunrise swim this morning. It was absolutely beautiful, and I just absolutely love the ocean. I love getting in amongst nature. I think it's really important. I think we're really removed from that. I mean, how many people do you see on their mobile phones? There's two guys the other day at the shopping centre. They're sitting right next to each other, and they're both on their mobile phones, and they're probably having a conversation with each other on their mobile phones, you know, sitting next to each other. And so there's a lot of social anxiety happening now. A lot of people don't know how to communicate because they're just texting
and then it's also like people are on their mobile phones and they're withdrawn from what's actually happening. And what are we missing out on? Now, while we're looking at our phones, there's a lot more going on in the world that I think it's all a distraction. It's distracting us from what's really happening, the actual issues that are affecting, you know, humankind. We're looking at our phone, the information we're getting on our phone, it's all filtered. Now, we're not getting the purest information. We're not getting what's actually going on. We're getting what people want us to know. And we start to form this, and we're being skewed into thinking and doing things a certain way. Whereas if we can just go, no phones, and actually be present and see what's going on, interact with people, that's what's important. People need to interact. As humans, we're meant to talk to one another. We're meant to help one another. And we're meant to have that physical and that emotional, and that spiritual connection. And it doesn't happen when we're on our phones. We're missing out.
That's true. It is very important, and that's probably one thing that's leading to a lot of depression out there. You know, that people are so removed from each other. In some ways we're communicating more than ever before, yet we're more detached than ever before. And now we've got robots coming into the picture. Now people are going to have robot partners, and you know, it's insane the way technology is going and how that's going to be affecting things. We're going to be even more removed. And you know, I totally believe that the masses are being brainwashed and by the mass media, and they need to wake up. That's why I love people like David Icke. He's helping to wake up the world to what's really going on out there, and helping to open people's eyes to what is happening. And I think really just question everything. That's a big message.
Absolutely. And I'll just share a personal story in regards to just people being kind of told, oh, that's just the way it is, blah, blah. My mum, she's been sick for about 15 years. It wasn't until I had enough tertiary education behind me where I was like, wait a minute, well, all this is preventable, and all this is, you can reverse this. For years, I told her that she had sleep apnea. I was telling her that, you need to be careful what you're eating. These symptoms you're telling me, it sounds like you've got diabetes. Go get checked. And she went to her doctor and she said, my son says I've got diabetes, or I'm at risk of being diabetic, blah, blah, because I'm so fatigued and I'm angry and I'm moody and all this. And the doctor said, no, you don't have diabetes. No testing. And she did have diabetes. And then then she actually collapsed at work. She collapsed at work, and they took her to the hospital and they did some tests, and they said, oh, how long have you been diabetic? She said, I'm not diabetic. She said, well, you are diabetic. She said, no. And what had happened is just And then she was told that, well, yeah, you've got diabetes now. It's from poor lifestyle, poor diet, and that was it. She wasn't told how to prevent it. She wasn't told how to reverse it. She's no longer diabetic. She finally started to listen to what I said, and she's like, oh, no, family never listened to their family, and she's improved her diet. She started doing some of this vagus nerve stimulation I was talking about earlier. We've been doing some laser on her brain, doing some transcranial low-level laser. Greatly changed her diet. She's keeping her carbohydrates below 20 grams a day. And yeah, she's lost 30 kilograms. She's gone back to her doctor, and the doctor said, oh, well, yeah, you're no longer diabetic. She doesn't need medication anymore. She's feeling great. In fact, she's got a second lease on life. All this has happened in 2 months. A lot can change. She's just decided, so she works as a paralegal, very corporate sort of world, sitting down, doing very highly stressed. She's just discovered, well, I don't actually like this. And she's like, you know what, I want to go to uni. So now she's 57. She's going back to uni. She's going to study a Bachelor of Health Science in nutritional medicine. And that's great. She's excited about it, and finally she's doing something that is important to her. But yeah, just in regards, don't want to go off on a tangent, but in regards to that, she was just told that, that's just the way it is. What you do is you take this medication, and you do this, and that was it. She was just told that's all you need to just take your medication. But she doesn't need the medication now. She feels great.
Well, that's awesome that you educated yourself enough to be able to help her. And if more people educated themselves, the ripple effect of that could be massive, right? And I really do believe in the power of one. And I think by being the best version of you that you can be, you can just impact so many people in your life. You have no idea, how many lives you can change by getting educated. So that's part of what we're doing here, is educating people and encouraging people to question things and look at things differently. So that's an awesome result, and I'm really happy for your mum on that. And it's never too late to change. I hear a lot of older people saying, oh, I've been doing this for years, I can't change now. And no, I disagree. Well, I think people create their own realities. If people say they're going to die at 80, they'll die at 80. In fact, it often happens, to the day almost that they turn 80 if they say that, So you've got to be really careful what you say to yourself. Because you do create your own reality, and we are extremely powerful. We don't get how powerful we really are as human beings. And we are companion animals, and we really do need, we need that connection. We need that connection not just with others, but we need to get connected with ourselves. A lot of people are running away from who they really are. They don't know who they are. They don't know why they're here. And so I think, having a happier life it also comes down to getting clear on your purpose as well. Do you have anything to say around purpose, or what your purpose is? You're obviously a very driven guy, Samuel. So how did you come to finding your purpose?
Well, basically, I knew I wanted to help people. I knew I liked to help people. And back when I was in high school, I was like, well, how do I do that? Do I want to be a physio? Do I want to be a doctor? And I found purpose in knowing that I'm not going to stop trying to help someone until I know I've done the best that I can. And that's what makes me so driven, that I actually care about each individual patient. They come in, it's personal to me. I go, you know what? No, I want you to get better. And they do get better. And it's just about knowing that what I'm doing it's improving the future. I'm educating my patients. They've even got patients now telling me, oh, my friend says that they've got like this headache, and then I told them to do this, and do you get the pain here? And then they did that. Now they don't have the headache. Like, they're starting to pass it down the chain. They were told, oh, well, you need to take this. And it's good. The message is getting spread that, you can treat yourself. You can treat yourself. You can actually take control of your life, reduce your pain. In every one of my treatments, every one of my patients that come in, I teach them exactly how everything I do on them, I teach them how to do to themselves, except for the needling and the electroneedling, which is a lot more invasive. But they're able to floss their own nerves, mobilize their own joints. They're taught how to breathe. They're taught all these things that the body needs and the body likes. So by treating the body and giving it what it needs, it functions better. And the same goes with diet. If you're eating the right food, your body's going to perform better, and you're not going to be in these disease states.
Yeah, absolutely. That's That's brilliant. So reducing pain, so you help with really a whole lot of things. You help with headaches, you help with back pain, you help with diabetes. What are some other issues people come to see you about?
So at the moment, I've been treating people with atrial fibrillation, which is an irregular heartbeat. I've been treating people with reflux, people with celiac disease, SIBO, slow digestion, bloating, anxiety, motivations. It's all linked. All this stuff is linked. Gut and brain, it's all linked. And I'm treating all of this stuff with vagus nerve stimulation because it's got innovations in all these parts and all these pathways. If you like, I've actually just typed a blog on vagus nerve stimulation. So if you'd like to, I can put a link in afterwards. We'll have a bit of a read and give you a bit of a better idea. Yes, I'm treating things that like you're not meant to, you apparently can't treat, and you just, oh, that's just the way it is. And like I've had people who I had a patient come up from Sydney, and he started with esophageal cancer, and they took the cancer out of the esophagus, but they actually cut the vagus nerve during the procedure. And after this, he had all these symptoms. He had no idea why. He kept going back to the doctor saying, I've got this intense cramping. I've got this severe reflux, and it was chronic. And he developed anxiety over it because he didn't know what he could eat. He could eat one thing one day, be perfect. He could eat the same thing the next day. He'd be bedridden for 2 days. So he'd try and have a lunch with his friend. He doesn't know what he can eat. And a friend of mine was telling me about her dad. This is the patient. And I said, oh, this sounds like vagus nerve. Like, what's going on? And he kept saying, well, why am I in this pain? Why am I getting all these symptoms? And the doctor's like, oh, well, I don't know. Like, just take take your protein pump inhibitors. And he came up from Sydney. I did an assessment, and it came down to something that was quite simple. A lot of the time, it's actually something quite simple. It's not so complex that people think. It's simple, and he's been doing what I've asked him. And 2 weeks, he had an 80% reduction in symptoms in 2 weeks. Yet he's not getting the heartburn. In fact, he's even stopped. I got in contact with his daughter the other day, and he's even stopped doing the vagus nerve stimulation. She's like, keep doing it. And he says, I don't need to. He says, I've got no symptoms. I said, I feel great. And all this has happened this year. Like this, I probably was contacted March. He's doing great. And he's got his own food truck now, and he's traveling around Australia, making food, and he's doing what he loves. And it's just, one thing can affect your whole life in so many different ways. One thing can just conquer you, and you can't let it conquer you. Your health, it's actually within your hands. You do have the ability to improve it. You've just got to research, become educated. If you're not sure about something, look it up, research it. Don't just go, well, some person told me this, that's what I'm going to do. Like that's what I've done. I was told certain things growing up, and I've learned to guess that. Oh, okay, well, why is that? Look it up, and now I've got an understanding, and I know how things work. And a lot of the time, people just pass on information that they've been told. Like, oh, a person told me this, the person told me that. They don't actually know. And they could be passing the wrong message down the line, and it can go for generations.
And well said. And vagus nerve stimulation, you're one of only just a few practitioners in Australia that are actually using this medicine technique, modern medicine technique. And in the notes we've got here, you've been treating depression, anxiety, neuroplasticity, inflammatory disorders, irregular heartbeats, memory, PTSD, reflux, and much more. Have you found just more recently there's been more of one thing than another, or is it pretty much right across the board?
Primarily, I'm seeing more people with depression, so a lot more depressive patients. Also, the second practice I've got here in Rosalie, we've got 2 psychologists here, so that's given me a much better sort of network to get cross-referral going on, and we can compare and we can actually see their improvements. So it's good to have other health professionals on side and referring, and we can try it. And every single person I've been treating has noticed improvement. There's not one person who goes, no, it just doesn't work. We've got an improvement in either sleep, focus, in memory, and all of these things are depressive related as well. So, if you're not seeing improvement in the mood initially, you're going to be seeing improvement in other aspects that relate to that. It is great. And I'm just so happy that I'm able to help people, and that they're starting to feel like they're regaining their own life again, which is what I want to do. I want people to be able to do stuff for themselves and be proud and happy and not feel sick. That's the whole idea. You don't want people to feel sick. There's enough sick people in this world. It's sad.
Yes, there are. And the biggest side effect of antidepressant medication is suicide, is what I've heard. And I have a few friends that have actually died from suicide. So be very careful with any medication around depression, I would suggest, for anyone who has depression. There are other ways to help your depression, like get creative, exercise, move your body, think of things you're grateful for, lots of different things. I've had depression over the years myself. And I know sometimes you can feel like you're in a very dark hole and there's no light at the end of the tunnel. But, it's kind of like the roller coaster of life. Life is like a roller coaster, and sometimes you're going to go through some down periods. However, the trick is that when you have those periods is to be able to push yourself through and come back up the roller coaster and just stay on the ride, and because it is an amazing ride. And I talk about that in detail in one of my other shows, Health Xpose TV, where I interviewed Tracy Corman. So for anyone watching this, if you want to know more about how to help depression naturally, have a look at that show with Tracy Corman. It's on the Aldwyn Altuney YouTube channel. We're coming to almost the end of our show now, Samuel. We could just keep chatting for ages about this. It's been really insightful and so much we can talk about. Anything else you want to say about, maybe reducing pain, or how people can be happier and healthier in 2018, New Year's resolution? What can they do now for the coming year to as well as everything we've mentioned? Any other tips for people?
Well, basically, we should be setting ourselves some goals as well. So if we're not setting goals, we're not really making an effort to reach anything. It's in regards to like what I do. If you're not testing, you're guessing. And if you're not setting goals in your life, how can you measure? You've got nothing to achieve. So set yourself some goals. It's important to set short-term goals and long-term goals. Short-term goals, something you can achieve in under a month. Set something you've got to be realistic as well. You think, what can I do? You know what? I want to start cycling, or want to start swimming, or something you want to do that's personal to you. And it's important that it's personal to you, because if it's not something that you personally want to do, you're not going to do it. You think about who you are as a person and what you want to do. And when you start knocking these goals down, then you think, you know what, I'm going to try and do this. I'm going to try and do that. Before you know it, it's been a year, and you think, well, look what I've achieved in this whole year. And you look back on it, and then you've got a whole another year, and we can just keep progressing. It's important. First of all, I'd recommend diet. You've got to get your diet sorted. The diet is the root of so many things. It's the trigger of so many things. Even though I'm a musculoskeletal therapist, I see the importance of diet. A lot of the patients who are in chronic pain states, you look at their diet and you think, well, no wonder. Like, you've got the pain and you're basically just throwing the fuel on the fire. So get your diet right, get your lifestyle right, and it starts with goals. Set yourself something to do. I don't know, get yourself a gym membership, play with your kids. What do you want to do?
What makes you happy?
Yes, what makes you happy, exactly. And that's why I do what I do, because I love it. I love my job. I love helping people. And every day I just think, there's not one day I come in and I go, I don't want to do this. I couldn't be bothered doing this. Like, I love it. I wake up, I go, cool, I've got Joe Blow coming today with this. We got an 80% improvement in his pain last week. Let's see what we can do this week. I see him and he goes, Sam, it's the best I've felt in months. And I go, that's great. And it's good. And all I want to do is help people. And it's good.
That is awesome. I love it. I absolutely love it. And you've got some workshops coming up that people can attend. Is that right? Can you tell us about those?
Yes, I do. So in February, I'm running 4 workshops. So the first one's going to be joint mobility of the upper body. And then the week after, it goes nerve mobility of the upper body. And the week after, it goes joint mobility of the lower body. The week after, it goes nerve mobility of the lower body. And the way why I've done this is because I want people to understand the relationship between joint and nerve and how it causes these downstream symptoms. So I've done it in a way that, so if you come to the first workshop, you learn about the joint, and then you start learning about the nerves in the upper body, and straight away the information you just learned the week prior is still fresh in your mind. And then you go, oh, that makes sense. And then you might wake up one day and go, oh, I've got this kink in my neck, and you go, was it joint? Is it nerve? And you can just do a little assessment. You can treat it, and you go. You don't have to call up a clinic. You don't have to book in the treatments. It's about understanding your body and doing what you're actually capable of doing. So yeah, that would be good. If people want to come in for any of those workshops, they're going to be run out of City Cave in Paddington, which is in Brisbane, Australia. And yeah, February bookings are essential. But there's going to be a lot of information. I'm going to give out some workbooks, and yeah, it's going to be great. It's going to be great to help people.
Sounds brilliant. And is that a free event or low-cost event? How much is that?
It's going to be a low-cost event at the moment. It's going to be about $30 per person.
Okay.
And it's a small price to pay for the ability to take control of your life and treat yourself. And primarily, the reason I've thought, okay, well, these workshops need to happen, people need to be educated, is because so many people come in with tight muscles and they say, oh, I've got tight muscles, I've got muscle pain, I've got this, and it's not that. Like, you can rub a muscle all day, every day, but a lot of the time it's not the problem. It's a nerve issue, it's a joint issue. That the nerves aren't moving correctly. Nerves like mobility, they like the ability to move and floss through their pathway. So in treating the nerve and treating the joint, you actually eliminate the reason why the muscle was tight in the first place. And you're not just chasing a symptom like, oh, tight muscle, we'll release it. See you in 2 days. Tight muscle, we'll just release it. Because that doesn't end. That can go on for years. So people treating themselves and actually starting to eliminate the causative and the root causes to their presenting issues.
They sound like brilliant workshops. And where can people book for those? Is there a website link?
Yes, I can. I'll post the website link up after this. It'll be through the City Cave. So if you Google City Cave, you'll easily be able to find the up-and-coming workshops. And yeah, it'd be good. Or you can message me directly on Recuperate Health and Wellbeing. So I've got a website, Recuperate Health and Wellbeing, or you can email me at recuperatehealthandwellbeing@gmail.com, or even add me on Instagram. I commonly put videos, informative videos up on Instagram showing some of the different techniques I use and the importance of the techniques. So yeah, give us a follow.
Awesome. I love your Instagram. It's very cool. You do some really cool stuff on that. So I'm following you and checking out the latest news. So, and that's Recuperate Health and Wellbeing and spelled out. Is that correct? A-N-D?
Correct. A-N-D.
Okay. Perfect. Fantastic. Any final comments before we wrap up, Samuel?
No, just I'd like to thank you for having me today. It was a pleasure talking and being able to help people. If anybody has any questions, don't hesitate to ask my opinion. I'd like to share my knowledge with as many people as I can, and I'd like to be a mentor to people, so then people can mentor other people. It's all about people helping each other, helping each other, helping each other.
Absolutely. Well said. Thank you so much, Samuel. It's been an absolute pleasure having you on the show, our very first Health Xpose TV episode. And if anyone's watching this and you have a great story to share, or any sort of ways of dealing with health in any way that is against generally what mass media says is the right way to go, then we're all ears here. We want to express some alternative points of view to the mainstream here on Health Xpose TV, and that's what we've done today. So thank you so much, Samuel, once again, and I'm sure you'll end up with a lot of followers from this. So we'll post those links underneath this YouTube video. We'll put some links there in the comments of the workshop booking and anything else you want to put it in there. And if you've been watching this, thank you so much for joining us. It's been great to have you. And if you do like what you've seen, please share the love. Share this video with your friends on Facebook, social media. We would love that. Or any comments, any questions you have as well, just pop them underneath this video link wherever you are watching it right now. And we'd love to hear from you. Any feedback, questions, comments. Thank you so much. I'm Aldwyn Altuney, and it's been great to be with you today. And wherever you are in the world, learn to be your own best friend, as Ben Harvey says in Authentic Education in Sydney, and live your love and really be the best that you can be. So love yourself, love others. And if you love yourself, you're going to eat healthy, you're going to look after your body, and you will be happier, and you will be able to reduce pain. And Samuel's techniques are absolutely brilliant. So make sure you check him out if you have any health issues whatsoever. Thanks once again, Samuel. And thank you to everyone for watching. And we'll see you again soon. Bye for now.